Hi, my name is Dr. Alif Musaji, the Smiling Dentist. Today we're going to talk about dental disease. So this is the second of a three-parter, and today we're going to focus on gum disease. Gum disease, in my humble opinion, is a poor term. It's too broad because gum disease affects lots and lots and lots of people, but for most of them, it's a very simple and innocuous disease to fix, whereas for some, it's a very serious disease that can actually be a real threat to the whole of the mouth and all of the teeth within. So as professionals, we have two terms. One of them is gingivitis, the other one is periodontitis. So let me elaborate a little bit. Gum disease happens when there is inflammation in the mouth. Inflammation's a good word. Irritation is also another very good word to really describe what that means. And if we think about what is being affected, it's the supporting tissues for the tooth. So this could be gum, but also bone and ligaments as well. So with gingivitis, this inflammation or irritation is completely enclosed within the gum, just the soft gum that's around there. And normally it would manifest with the gums bleeding, looking red, and normally there isn't soreness, believe it or not. It's normally a silent disease. And if we're able to improve brushing and cleaning, then it will improve the situation, because this particular disease is fueled by plaque, the bacteria that are allowed to stagnate within the mouth. Now, there is something that we should clarify with this, because we are aware that there are bacteria in the mouth. We all have them. But what's more important than eradicating them is actually trying to have a relationship with them. So we want that relationship to be a good relationship. We're aware that now the human body, there's bacteria throughout our bodies, and we want to try and improve that relationship with them so that it reduces the amount of disease that we experience. Now, how we do that in the mouth actually is quite simple and straightforward for the majority of cases. Now, I know there are some complex ones, but let's talk about the majority that affects most people. So if we allow bacteria to stay and stagnate and fester in the mouth, then what happens is that the type of bacteria that are there change. If you imagine, and I know this is simplistic, but we're going to try and keep it very simplistic for this video. So imagine we have bacteria that are just one level on the surface of the gum. All of these bacteria would be exposed to air, and this type of bacteria would be aerobic. And generally these aerobic bacteria, the air-loving ones, are friendly, and they won't cause you disease. They're good, that we can work in partnership with them. The problem happens if these particular bacteria are not removed, like with daily brushing or cleaning, mechanical cleaning, then another layer of bacteria can sit on them, and then another layer, and then another layer. And what happens is the bacteria at the bottom of that wall, if you like, suddenly these bacteria are not getting oxygen, so they change. These become anaerobic bacteria. And anaerobic or not oxygen-loving bacteria, because there's no oxygen getting to them, those are the ones that generally cause us disease. Their partnership with us is not a good one. They will generally cause the irritation and fuel this inflammation. And so this is when we start to see the diseases. As we mentioned at the moment, we're just talking about gingivitis, but we see the disease present on the surface of the gum. This inflammation, the redness and the bleeding is present. So you can see why most of the time when dentists are coaching patients, we're talking to patients about removing and disrupting this organized wall of the bacteria so that we can get back to these friendly aerobic bacteria the inflammation reduces and the bleeding stops. And this is the best way to manage gingivitis. Gingivitis, on one hand, is a really important disease because it gives us as dentists and dental professionals an insight into where there are areas that are being cleaned well and conversely not so well. But one of the nice things about gingivitis is it's not a threat to the tooth in the respect that you will lose the tooth or lose the structure from around it. So managing gingivitis is actually quite a simple and straightforward thing to do. We can do some professional cleaning and then, more importantly, arm you with some information about how well to clean those areas so that we can improve them. But now let's talk a little bit more about periodontitis. So we mentioned before that there is the gum, but there is also bone and ligament as well. And you can imagine from a functional point of view, they are ever so important. Teeth, we see, the part we can see is called the crown, but there is also a root of the tooth which is held deep in the bone. And it's the bone that provides the support and the anchorage for that tooth. So if for any reason the bone starts to shrink away and is lost, then you can imagine the tooth will start to wobble and eventually it will be lost. So it's a really, really important disease from the point of view of maintaining a patient's dentition, because you can imagine this loss could be a gradual thing and most of the time it's painless, so you don't even know it's happening. This is why it's so important to come for regular inspections so we can measure the level of bone around the teeth. But you can imagine that if it happens and it's happening generally to both the lower jaw and the upper jaw, this won't be a single tooth problem. It will be a whole mouth problem because all the teeth will start to wobble, and it's a big problem to try and fix. So with respect to periodontitis, there is a genetic component and some people are more susceptible. So when this inflammatory response happens, it isn't just confined to the gum like it is in gingivitis, it spreads and it affects the bone, it affects the ligament. And the toxic environment that we spoke about earlier, these toxins that are released, the bone doesn't like it. And so what it does is it starts to wall itself away. It actually shrinks back so that it's further away from the toxic environment. The problem though is that when the bone shrinks back, the bacteria can advance, and they advance often into what we call a pocket, a place where it becomes even harder for them to be removed and cleaned properly because they're hidden a little bit. The bone goes, but the gum stays. So that's what provides this shelter for them to live and really have a party. So when the toxic environment advances, the bone shrinks again. The toxic environment advances, the bone shrinks again. And this cycle perpetuates, or spiral perpetuates, until things are so bad that we notice that so much of the support has gone that the tooth starts to wobble within the bone. It's very, very serious. And in terms of trying to treat this, we often have to do much deeper cleaning around the tooth to really remove all of this horrible environment that's there. And then what often happens is the gum will then shrink back, but then we're left with gums that have receded, but at least the environment is healthy again. The balance is improved so that the ongoing loss of bone is stopped. And if we can stop the loss of bone before the wobbling of the tooth begins, then at least we will keep the dentition functional so that we're able to chew and bite as we could before. So it's so important to see the dentist regularly to ensure that this gum problem is not perpetuating, because we don't know if we're one of the people who are susceptible to it or not. It's only when we have an assessment that we as dentists and dental professionals are able to tell you whether you are at risk of this disease or not. I hope you enjoyed this video and please do join us on the Smiling Dentist channel and like, subscribe and share if you want to see more videos.